Welcome to the Medical Terminology, Anatomy, and Physiology course for medical interpreters. We are glad you're here. In this course, we will cover the basic knowledge of anatomy and physiology of the body systems, along with the most common and important to know conditions, tests, and procedures. This course is language neutral. That means that all of the information presented to you here will be in English. I would like to encourage you to start your personal glossary, where you will write down all of the unfamiliar terminology learned and translate it into your own language to be able to use it successfully. Are you ready? Let's begin. Here are the topics covered in this course: terminology, body systems, musculoskeletal, integumentary, circulatory, respiratory, nervous, endocrine, immune, digestive, urinary, reproductive, and the eyes. What is medical terminology? Medical terminology is a specialized area of technical vocabulary used to describe the human body, its conditions and diseases, and the processes and procedures associated with the diagnosis, care, and treatment of the patient. Why does it matter to know medical terminology? You will need to know medical terms as a medical interpreter because clarifying, requesting an explanation may be inappropriate for a diagnosis. The patient should know the exact diagnosis, a test or procedure, surgery, some terms in discharge instructions. Here's the secret. How much of medical terminology do you think is based on Latin and Greek terms? How much? About 75%. Think of interpreting medical terminology as a game. The game is about meaning, extracting the meaning of medical terms. Before you start, let me explain the basic rules of the game. Medical terms consist of roots and affixes. Root is a primary lexical unit of a word. It contains the core meaning, such as cardio, which refers to heart. Affix is any morpheme, a small linguistic unit with meaning. It could be a prefix, which is an affix that comes before the root, or a suffix. It's an affix that comes after a root. Why do they matter? Well, root plus affix carry the meaning. Affixes do not change meaning. They add a layer of meaning to roots. For example, the suffix logi means study or science of. So cardiology would mean the study of the heart and the heart disease. So what are the steps to interpret any Greek or Latin terms? Here are the simple steps. Step 1. Analyze the meaning of the roots, prefixes, and suffixes. Step 2. Convey the meaning into the target language. Here's an example. Ipsilateral. It would be the prefix ipsi, which means same, the root later, which means side, and the suffix l, which means related to. Now, let's put it together. To interpret ipsilateral, find the words in the target language to convey the idea of related to or on the same side. Now, let's review. Root of the word is the part of the word that gives its core meaning. Prefix is the part that appears before the root. Suffix is the part that appears after the root. Ipsilateral. A word with two or more roots is referred to as a compound. For instance, foot plus ball becomes football. For example, gastrointestinal has the root gastro, which means stomach, and intestine, plus the suffix l, which means about, related to. Gastrointestinal. Here are some examples of how to build words. For instance, prefix hyper, which means excessive. Root would be pleasure, which is formation or growth. And the final word becomes hyperpleasure. Or the root gynec, female, suffix logy, which means the study of, and the final word becomes gynecology. The root plus connecting vowel is called the combining form of the root. Many combinations are possible. Often the letter O or another vowel connects roots and affixes. For example, gynecology. Sometimes a consonant like T connects a root and an affix. For example, dermatitis. Ignore that letter, it means nothing. Now let's review how to put the words together. Prefix plus root could be hyperpleasure. Hyper means excessive, and pleasure means formation or growth, and it becomes hyperpleasure. Here's an example for root plus suffix combination: gynecology. Gynec, female, plus logy, study of, gynecology. Here is an example for prefix and a suffix combination. Narcolepsy. Narco, sleep or numbness, plus lepsy, that means attack or seizure. Narcolepsy. Let's play the puzzle game. Just follow the steps to interpret the term. Step 1. Find the meaning of the suffix. Step 2. Find the meaning of the prefix. Step 3. Find the meaning of the root. Now put it all together and interpret the meaning. Remember, it's a game. Just take bits of meaning and put them together into a larger meaning. Then interpret the meaning. Now it's time to talk about register and terminology. Do you know what register is? Register refers to level of language. It means the way a speaker uses language differently in tone, style, and formality. High register speech is formal. Low register language tends to be relaxed, informal, or slang. Why does register matter, you can ask? Many high register medical terms come from Greek or Latin. Changing register, for example, to simplify the provider's message or make the patient sound clear or more polite, is not permitted. You are not the provider or the client. Changing their message is not your job. Changing a message is very risky. Instead, get the speaker or signer to change register. It should be them, not you. Yes, it could be challenging to keep the correct register sometimes. If you are uncomfortable because the provider's register seems high, avoid saying that the patient doesn't understand. Don't ask the patient about it. Instead, just tell the provider, "Excuse me, as the interpreter, I'm afraid what I'm interpreting isn't clear. If you explain the topic in question, I may be able to interpret it more clearly." Then report what you've just said to the patient. Are you up for the challenge? As per NCIHC Standards of Practice, the interpreter replicates the register, style, and tone of the speaker. For example, unless there is no equivalent in the patient's language, an interpreter does not substitute simpler explanations for the medical term that a provider uses, but may ask the speaker to re-express themselves in a language more easily understood by the other party. Why do we need to study body systems? A good knowledge of body systems helps you to understand medical terms in context, remember the terms better, learn whole categories of terms, and enhance your accuracy. There is always a need to interpret signs and symptoms in medical encounters. You will need to interpret signs and symptoms accurately for correct diagnosis. Health professionals use signs and symptoms to schedule follow-up, make decisions about tests, provide an informed diagnosis, negotiate a treatment plan, plan procedures, schedule follow-up. What could be so tough about symptoms? Well, symptoms can be hard to interpret, and there are just so many. Using the wrong term of any symptom can lead to the wrong diagnosis. For instance, be careful about terms for pain. Here are the types of pain you need to know: acute, burning, chronic, cramping, dull, excruciating, gnawing, jabbing, nagging, piercing, searing, severe, stabbing, sudden, throbbing, mild. And remember, practice, practice, practice. Body systems. A group of organs that work together to bring about a common result is called an organ system. Organ systems are fundamental in medicine. Medicine is studied, diseases are classified, and treatments are selected based on organ systems. Now, let's talk about anatomy and physiology. Anatomy is the study of the basic structure and parts of the body. Physiology is the study of how these parts and structures work. Body systems and homeostasis. Organs and organ systems communicate to stay in balance. This state of balance is called homeostasis. The first system we are going to talk about is musculoskeletal system. Essential function of the musculoskeletal system is to provide form, stability, and movement for the body. It provides a home for our internal organs. It helps us to produce blood and helps our bones to store minerals. Skeletal system. The skeletal system works as a support structure for your body. It gives the body its shape, allows movement, makes blood cells, provides protection for organs, and stores minerals. The muscular system. The muscular system is composed of specialized cells called muscle fibers. Their main function is contractibility. Muscles attached to bones or internal organs and blood vessels are responsible for movement. Nearly all movement in the body is the result of muscle contraction. The main muscle underneath the lungs that is involved in breathing is called a diaphragm. Let's talk about the essential parts of musculoskeletal system. They are bones, muscles, ligaments, tendons, cartilage. Let's talk about human bone structure. Bones have a hard outer structure and a soft inner marrow, a fatty substance. They contain bone marrow where blood cells are formed. They hold calcium. They act as growth plates. Joints and cartilage. Joints are where two or more bones make contact. Joints allow motion and provide support. Cartilage is a firm, elastic tissue that cushions bones at the joints. Ligaments and tendons. Ligaments are bands of tough tissue that connect two bones. Ligaments also connect cartilage at a joint or support an organ to allow movements. Tendons are bands of tough, elastic tissue that connect muscles to bones. Tendons and muscles work together. Now let's cover some sample terminology you need to know. Osteo is pertaining to bone. For instance, osteoma is a benign tumor of the head made of bone. Osteoarthritis is the inflammation of the joint that connect muscles to bones. Tendons and muscles work together. Now let's cover some sample terminology you need to know. Osteo is pertaining to bone. For instance, osteoma is a benign tumor of the head made of bone. Osteoarthritis is the inflammation of the joint due to wear and tear. Osteoma is due to wear and tear. Osteoma is a joint. Due to wear and tear. Arthro is pertaining to joint. For instance, arthroscopy is a procedure to view and treat the inside of a joint. Arthroplasty is the procedure to repair a joint. Chondro is pertaining to cartilage. For instance, chondritis is the inflammation of a cartilage. Costo is pertaining to rib. Costochondritis is the inflammation of the cartilage that connect a rib to the sternum. Now let's talk about sample diseases and disorders of the musculoskeletal system. Arthritis is an inflammation of a joint. Osteoarthritis is an inflammation of the bone due to wear and tear. Rheumatoid arthritis is an inflammatory disease. The immune system attacks healthy cells in the body by mistake, causing inflammation, in this case painful swelling, in the affected parts of the body. Fibromyalgia is pain that affects the body, often in muscles, joints, tendons, and soft tissues. Osteoporosis is the condition of gradual loss of bone density. Spinal stenosis, narrowing spaces in the spine leading to compression of the spinal nerves or the spinal cord. Gout is caused, in most cases, by very high levels of uric acid in blood. It results in swelling, redness, and sharp pain in the big toes or sometimes ankle or knee or other joints. Sprain is the condition when the ligaments are suddenly stretched or torn. Bursitis is the inflammation or irritation of a bursa sac, a cushion between the bones. Carpal tunnel syndrome is characterized by the pressure on the median nerve in the wrist. It causes tingling, numbness, weakness, or pain by a pinched or inflamed nerve. Let's talk about sample procedures. Arthroplasty is a procedure to repair a joint. Meniscectomy is the arthroscopic procedure that removes the meniscus or trims the damaged meniscus tissue. Arthroscopy is a procedure to view the inside of a joint. Densitometry is a procedure of measuring the density of the bones. It is used to detect the early stages of osteoporosis. Electromyography, EMG, is a procedure of recording of the electrical activity of the muscles. Integumentary system. The essential organs and structures of the integumentary system are skin, hair, nails. Skin is the largest organ in the body. Did you know that? There are 3 layers of the skin: epidermis, outer layer, thin and tough. It's waterproof and keeps most viruses, bacteria, and other foreign substances from entering the body. It has melanocytes that produce melanin, responsible for the color of skin. The next layer is dermis, or mid-layer, tough and thick. It has collagen and elastic tissue, nerve endings, sweat glands, and oil, sebaceous glands, hair follicles, and blood vessels that regulate body temperature. Hypodermis, the fat layer. It varies in thickness. It helps to insulate the body from heat and cold. The skin protects the body, acting as a barrier against dangerous substances and trauma. It shields us from the harmful effects of UV radiation. It regulates body temperature. It maintains water and electrolyte balance. It senses painful and pleasant stimuli. It participates in vitamin D synthesis. Now let's talk about sample terminology you need to know. Derm, it's pertaining to the skin. For instance, dermatitis, the inflammation of the skin. Seb is pertaining to sebum, oil. For instance, seborrhea, a skin condition that causes scaly areas and red skin, especially on the scalp. Melan is dark or black. For instance, melanocyte is the cell that produces melanin. Adip Lip is pertaining to fat. For example, adipose, tissue or body fat, is a loose connective tissue composed mostly of adipocytes. Hydro is pertaining to sweat. For example, anhidrosis. It's a condition of an abnormal lack of sweat. Let's talk about sample diseases and disorders related to this system. Psoriasis is a skin condition that causes redness, silvery scales, and skin irritation. Eczema. It's a common condition where patches of skin become inflamed, rough and blistered, which often causes itching and bleeding. Basal cell carcinoma is a type of skin cancer. Basal cell carcinoma begins in the basal cells. It's a type of cell within the skin that produces new skin cells as old ones die off. Melanoma is the most dangerous form of skin cancer. It's the cancer of the cells that produce color in our skin, melanin. Hives. It's an allergic reaction that causes raised bumps on the skin that can be itchy. It's also known as urticaria. Mole is a colored spot on the skin of various shapes, usually brown. Circulatory system. The heart of the circulatory system is, the heart. The heart's only function is to pump blood. The blood delivers oxygen and nutrients to the tissues and removes waste products from them. The essential parts of the cardiovascular system include the heart, the blood that consists of red blood cells, white blood cells, platelets, and plasma. Blood vessels that could be arteries, veins, or capillaries. Let's talk about the anatomy of the heart now. The heart is located between your lungs, in the middle of your chest, behind and slightly to the left of your breastbone or sternum. The heart has 4 chambers. The upper chambers are called the left and right atria. The lower chambers are called the left and right ventricles. You can see them in the picture. Heart valves prevent backflow of the blood in the heart chambers. The heart has 4 valves in it. They are tricuspid valve. It's located between the right atrium and the right ventricle. Pulmonary valve. It's located between the right ventricle and the pulmonary artery. Mitral valve, located between the left atrium and the left ventricle. An aortic valve, that is located between the left ventricle and aorta. Let's talk about the kinds of circulations there are. The pulmonary circulation, that is the circuit between the right side of the heart, lungs, and left atrium. The systemic circulation is the circuit between the left side of the heart, most of the body, and the right atrium. And finally, the coronary circulation. It includes the arteries that provide oxygen-rich blood to the heart muscle. Here's some sample terminology related to the circulatory system. Angiogram. It's a scan that shows blood flow through arteries or veins or through the heart using X-rays, computer tomography, angiography, CTA, or magnetic resonance angiography, MRA. The blood vessels appear on the image after a contrast dye is injected into the blood, which lights up on the scan wherever it flows. Bradycardia, abnormally slow rhythm of the heart. Tachycardia, abnormally fast rhythm of the heart. Cardiologist is a doctor specializing on the conditions of the heart. Myocardial infarction, permanent damage or death of a part of the heart muscle. Hematologist, it's a doctor specializing on the blood disorders. Glycemia, glucose or blood sugar. Venogram, it's a test that allows your doctor to see veins in your body, especially in your legs. Phlebotomist, it's a healthcare professional who collects blood samples from patients. Let's talk about some diseases or disorders of the circulatory system. Atrial fibrillation. It is the condition when the impulses travel in a rapid, disorganized way, causing the atria to contract irregularly. Coronary artery disease. This is the condition where fatty deposits build up in arteries carrying blood to the heart, leading to hardening of those arteries. Thrombophlebitis. It's an inflammatory process that causes blood clot to form and block one or more veins, usually in the legs. Congestive heart failure, CHF, the condition where the heart is unable to pump enough blood to keep the body healthy. Thrombosis is a formation of a blood clot that can partially or completely obstruct the blood flow in a vessel. Cardiomegaly. It's an enlarged heart. It's not a disease, but rather a sign of another condition. Angina, heart-related chest pain. Heart attack, or myocardial infarction. Infarction is death of a tissue. Arteriosclerosis is a condition of hardening of the arteries. Deep vein thrombosis, DVT. It's a condition when a blood clot forms in one or more of the deep veins in your body, usually in the legs. Embolism. It is an obstruction of a blood vessel by a foreign object or blood clot that can cause a serious damage. For example, pulmonary. It's not a disease, but rather a sign of another condition. Angina, heart-related chest pain. Heart attack, or myocardial infarction. Infarction is death of a tissue. Arteriosclerosis is a condition of hardening of the arteries. Deep vein thrombosis, DVT. It's a condition when a blood clot forms in one or more of the deep veins in your body, usually in the legs. Embolism. It is an obstruction of a blood vessel by a foreign object or blood clot that can cause a serious damage. For example, pulmonary embolism, a blockage in a blood vessel leading to the lungs that can sometimes cause death. Now we are going to cover some procedures related to the circulatory system. Coronary artery bypass surgery, CABS. It's pronounced as cabbage. The surgical procedure is done to allow blood to flow around blocked blood vessels in the heart. Coronary arteries. Heart catheterization. It's a procedure in which a thin, flexible tube, a catheter, is guided through a blood vessel to the heart to diagnose or treat certain heart conditions such as clogged arteries or irregular heartbeats. Coronary angioplasty. It's a procedure used to open clogged heart arteries. Angioplasty uses a tiny balloon catheter that is inserted in a blocked blood vessel to help widen it and improve blood flow to the heart. Angioplasty is often combined with the placement of a small wire mesh tube called a stent. It's done to keep the artery open. Electrocardiography, EKG, is the procedure to record the electrical activity of the heart. Echocardiography, or cardiac ultrasound. It's used to check how your heart chambers and valves are pumping blood through the heart. Holter monitor. It's a device that monitors the EKG for 24 to 48 hours. Cardiac stress test. In an exercise stress test, sensors or electrodes are taped to the chest to record the heart's rhythm. A healthcare provider monitors the heartbeat while a person walks on a treadmill or pedals a stationary bike. Nuclear stress test. A nuclear stress test uses a small amount of radioactive material, tracer, and an imaging machine to create pictures showing the blood flow to your heart. The test measures blood flow while you are at rest and during activity, showing areas with poor blood flow or damage in your heart. Here are some important symptoms that could be a sign of a cardiac condition: palpitations, fatigue, confusion, difficulty breathing or dyspnea, shortness of breath, dizziness, chest pain. And now, respiratory system. The main function of the respiratory system is the exchange of oxygen and carbon dioxide in the body. The respiratory system makes it possible to breathe. Its main function is to support breathing. Respiration. Other key functions of the respiratory system are giving us a voice by vibrating our vocal cords to make human sounds that let us speak, helping us to smell and taste, and exchanging gases, oxygen and carbon dioxide, between the lungs and the bloodstream. And between the bloodstream and our body tissues. Here are the essential parts of the respiratory system: lungs, airways, linked blood vessels, muscles, nasal cavity, nose, sinuses, pharynx, larynx, trachea, bronchi, bronchioles, alveoli, capillaries, diaphragm, pleura, thorax. Now let's talk about these parts in detail. Lungs is the organ for respiration, where oxygen is inhaled and carbon dioxide is exhaled. They are located in thoracic cavity. Pharynx is throat, back of the mouth. It's a muscular tube that divides into trachea and esophagus. Larynx is also known as voice box, forms the upper part of the trachea that carries air to the lungs. Diaphragm, a large flat muscle that separates the lungs from the stomach area and that is used in breathing. It enables thoracic cavity to be increased and decreased. Trachea, it's also called windpipe. It's the tube that carries the air from the larynx to the two bronchial tubes that lead to the lungs. Bronchus, there are two tubes that carry air from the trachea to the right and left lung. Alveoli, small, thin-walled air containing compartments of the lung that are typically arranged in sac-like clusters. Pleura is covering of the lungs. The essential process of the respiratory system is ventilation, that is when the air moving in and out of the lungs, diffusion, which is spontaneous movement of gas from the alveoli and the blood in the pulmonary capillaries, perfusion, cardiovascular system pumping blood through the lungs. Here's some sample terminology related to the respiratory system. Bronchitis, the inflammation of the lining of your bronchial tubes. Bronchoscopy is the procedure to view the airways. Pneumonia is a common and serious lung inflammation that can cause sacs in the lungs to fill with fluid or pus. Pneumocytes are cells lining the alveoli, the air sacs in the lung. Pulmonary means pertaining to the lung. Pulmonologist is a physician who specializes in the respiratory system. Now let's talk about some sample diseases or disorders of the respiratory system. You need to know them in order to have a successful and smooth interpreting session in a medical setting. Asthma. It's a constriction of the airways when breathing causes the airways to narrow, making it difficult for air to flow in and out of the lungs. Emphysema. It's a destructive disease that damages and enlarges the air sacs in the lungs and leads to shortness of breath. It's one of the COPD diseases. Pneumonia. It's a common and serious lung inflammation, usually bacterial or viral, that can cause sacs in the lungs to fill with fluid or pus. COPD stands for chronic obstructive pulmonary disease. It's a group of disorders that prevent proper airflow in and out of the lungs and that can interfere with the gas exchange. Cystic fibrosis, CF, is an inherited disorder that causes severe damage to the lungs, digestive system, and other organs in the body. Cystic fibrosis affects the cells that produce mucus, sweat, and digestive juices. Tuberculosis, or TB, is a potentially serious infectious disease that mainly affects the lungs. The bacteria that cause tuberculosis are spread from person to person through tiny droplets released into the air via coughs and sneezes. Lung cancer. Lung cancer is a type of cancer that begins in the lungs. Sleep apnea is a potentially serious sleep disorder in which breathing while asleep stops and starts, interfering with the body's ability to get sufficient oxygen and quality sleep. ARDS, acute respiratory distress syndrome. It occurs when fluid builds up in a tiny elastic air sacs, alveoli, in your lungs. Croup, or laryngotracheobronchitis. It's the condition when the upper airway is infected with the virus that causes croup, and the tissues around the voice box, or larynx, and a windpipe, trachea, will swell. Laryngitis, the inflammation of the larynx. Pharyngitis, the inflammation of the pharynx. Tracheitis is the inflammation of the trachea. COVID, coronavirus disease 2019. Coronaviruses are a family of viruses that can cause illnesses such as common cold, severe acute respiratory syndrome, or SARS, and Middle East respiratory syndrome, MERS. Pulmonary edema. Pulmonary edema is a condition caused by excess fluid in the lungs. This fluid collects in the numerous air sacs in the lungs, making it difficult to breathe. Pulmonary embolism. It's a blood clot that blocks the pulmonary artery and can reduce or stop the flow of blood in small blood vessels and interfere with the gas exchange. Pulmonary fibrosis is a lung disease that occurs when lung tissue becomes damaged and scarred. Mesothelioma. It's a form of lung cancer caused by exposure to asbestos dust. Pulmonary hypertension. It's a type of high blood pressure that affects the arteries in the lungs and the right side of the heart. Pleural effusion is a condition when the fluid builds in the pleural space. Pneumothorax. It's a collapsed lung. A pneumothorax occurs when air leaks into the space between your lung and chest wall. Now let's talk about different procedures, tests, and devices related to the respiratory system. Spirometer. It's a device to measure the volume of air going in and out of the lungs. Ventilator. Mechanical ventilators are machines that act as bellows to move air in and out of the lungs. Bronchoscope. It's a device to view the inside of the airways. Oximeter is a device that uses light beams to estimate the oxygen saturation of the blood and the pulse rate. It's usually placed on a finger. ABG, that stands for arterial blood gas test. This test measures how much oxygen and carbon dioxide are in the blood. Pulmonary function test, or PFTs, breathing tests to find out how well a person can move air in and out of the lungs and how well oxygen enters their bloodstream. Acid-fast bacillus test is a test that detects the presence of a bacteria called acid-fast bacilli that causes tuberculosis. Here are the most common procedures related to the respiratory system. Bronchoscopy, it's a procedure to view the airways. Tracheotomy, a surgical incision into trachea. Tracheostomy, the surgical opening into the trachea that can be left open as an airway or be a side of a tracheostomy tube. Lobectomy, pertaining to the lungs here, is a removal of a part of the lung. Laryngectomy, a removal of to bronchoscope. It's a device arteries in the lungs and the right side of the heart. Bronchoscope. It's a device to view the inside of the airways. Oximeter is a device that uses light beams to estimate the oxygen saturation of the blood and the pulse rate. It's usually placed on a finger. ABG, that stands for arterial blood gas test. This test measures how much oxygen and carbon dioxide are in the blood. Pulmonary function test, or PFTs, breathing tests to find out how well a person can move air in and out of the lungs and how well oxygen to find out how well a person can move. Bronchoscope. It's a device in the blood. Pulmonary function test, or PFTs, breathing tests to find out how well a person can move air in and out of the lungs and how well oxygen enters their bloodstream. Acid-fast bacillus test is a test that detects the presence of a bacteria called acid-fast bacilli to find out how well a person can move air in and out of the lungs and how well oxygen enters their bloodstream. Acid-fast to find out how well a person can move air in and out of the lungs and how well oxygen enters their bloodstream. Acid-fast bacillus test is a test that to find out how well a person can move air in and out of the lungs and how well oxygen enters their bloodstream. Acid-fast bacillus test is a test that detects the presence of a bacteria called to find out how well a person can move air in and out of the lungs and how well oxygen enters their bloodstream. Acid-fast bacillus test is a test that detects the presence of a bacteria called acid-fast bacilli that causes tuberculosis bloodstream. Acid-fast bacillus test is a test that detects the presence of a bacteria called acid-fast bacilli that causes tuberculosis. Here are the most common procedures related to the respiratory system. Bronchoscopy that causes tuberculosis. Bacilli that causes acid-fast bacilli called acid-fast bacilli is a test that detects the presence of a bacteria. Acid-fast bacillus test is a test that detects enters their bloodstream. Acid-fast bacillus test is a test that detects the presence of a bacteria called acid-fast bacilli that causes tuberculosis. Here are the most common procedures related to the respiratory system. Bronchoscopy, it's a procedure to view the airways. Tracheotomy, a surgical incision into trachea. Tracheostomy, the surgical opening into the trachea that can be left open as an airway or be a side of a tracheostomy tube. Lobectomy, pertaining to the lungs here, is a removal of a part of the lung. Laryngectomy, a removal of the larynx. Rhinoplasty is a surgical procedure done on the nose to change the appearance and improve breathing. Tonsillectomy, the removal of the tonsils. Thoracentesis, it's a procedure to remove fluid or air from around the lungs. Nervous system. It is our conductor. It senses our surroundings, collects information. Nervous system. It is our conductor. It senses our surroundings, collects information. It assesses and processes the information received. It executes an action by sending the information to other parts of the body, telling them what to do. Our nervous system consists of central nervous system that includes brain and spinal cord, and peripheral nervous system that contains of cranial and spinal nerves, and autonomic peripheral nervous system that contains of cranial and spinal nerves, cranial and spinal nerves, and autonomic nervous system. Central nervous system includes the brain and the spinal cord. The brain consists of cerebrum, brainstem, that's midbrain, pons, and medulla oblongata, and cerebellum. Here's the anatomy of the human brain. You can see frontal lobe, parietal lobe, occipital lobe, temporal lobe, cerebellum. Peripheral nervous system is one of the two components of the nervous system. It consists of all nerves coming out from the brain and spinal cord. Its role to connect the CNS or central nervous system to organs, muscles of the body, and to the skin. It also allows CNS to exchange information with other parts of the body. Let's look at some sample terminology. Cerebral. It's pertaining to the cerebral cortex or gray matter. Encephalopathy. Brain and spinal cortex or gray matter. Encephalopathy. It's a disease or abnormal condition of the brain. Cranial. It's pertaining to the skull. Meningitis. It's an inflammation or swelling of the protective membranes, meninges, covering the brain and spinal cord. Meningioma. It's a brain tumor originated in the meninges. The most common type of primary brain tumors. Neuropathy. Peripheral here. It's a result of damage to the nerves located outside of the brain and spinal cord. Peripheral nerves. Often causes weakness, numbness, and pain, usually in the hands and feet. Migraine is a headache that can cause severe throbbing pain or a throbbing sensation, usually on one side. It's often accompanied by nausea, vomiting, and sensitivity to light and sound. Peripheral nerves. Often causes weakness, numbness, and pain, usually in the hands and feet. Migraine is a headache that can cause severe throbbing pain or a throbbing sensation, usually on one side. It's often accompanied by nausea, vomiting, and sensitivity to light and sound. Migraine attacks can last from hours to days. Epilepsy. It's a long-term neurological condition characterized by recurrent seizures. Cerebrovascular accident, also known as stroke. It's when blood flow to a part of your brain is stopped, either by a blockage or the rupture of a blood vessel. Parkinson's disease. It's a disorder of the central nervous system that affects movements and includes tremors. Dementia is a long-term disorder of mental process caused by brain disease or injury. Cerebral palsy. It's a group of disorders that affect a person's ability to move and maintain balance and posture. Concussion is an affect a person's ability to move and maintain balance and posture. Concussion is a traumatic brain injury. Aphasia is the inability to speak or without speech. Hemiplegia. It's the paralysis of either one side of the body, left or right. Cerebral aneurysm. It's a ballooning arising from a weakened area by brain disease or injury. Cerebral palsy. It's a group of disorders that affect a person's ability to move and maintain balance and posture. Concussion is a traumatic brain injury. Aphasia is the inability to speak or without speech. Hemiplegia. It's the paralysis of either one side of the body, left or right. Cerebral aneurysm. It's a ballooning arising from a weakened area in the wall of a blood vessel in the brain. Encephalitis. That's the inflammation of the active tissues of the brain caused by an infection or an autoimmune response. Traumatic brain injury is a sudden injury that causes damage to the brain. Spinal cord encephalitis. That's the inflammation of the active tissues of the brain caused by an infection or an autoimmune response. Traumatic brain injury is a sudden injury that causes damage to the brain. Spinal cord injury is damage to the tight bundle of cells and nerves that sends and receives signals from the brain to and from the rest of the body. Bell's palsy is an unexpected episode of facial muscle weakness or paralysis. Paraplegia. It's the paralysis from the waist down. Dysphalgia is difficulty to swallow. Narcolepsy is a chronic sleep disorder that causes overwhelming daytime drowsiness. Microcephalus is a neurological condition in which the infant's head is smaller than normal compared to other infants of the same age and sex. Infant's head is smaller than normal compared to other infants of the same age and sex. Hydrocephalus. That's the excessive accumulation of fluid in the brain. Insomnia. It's a prolonged inability to sleep. usually a symptom of another condition. Cephalgia or encephalalgia, that's a headache. What do you know about the stroke? The stroke can be cerebrovascular accident or CVA, and there are two types of stroke: ischemic stroke or hemorrhagic stroke. Another type of stroke can be a transient ischemic attack or TIA. It's also called a mini stroke. The event is called a mini stroke if the symptoms are temporary without the permanent brain damage. Here are the symptoms of a stroke: numbness, weakness. Here are the symptoms of a stroke: numbness, weakness, confusion, aphasia, weakness, confusion, aphasia, dysphagia, dizziness, loss of balance, sudden severe headache, loss of consciousness, paralysis on one side. Do you know what the difference is between the epilepsy and seizures? Well, epilepsy is epilepsy in the epilepsy and seizures. Well, epilepsy is a disorder characterized by recurrent seizures and seizures. Well, epilepsy is a disorder characterized by recurrent seizures. It's a disorder characterized by recurrent seizures. Seizure is a brief temporary disturbance characterized by recurrent seizures. Seizure is a brief temporary seizure is a brief temporary disturbance in the electrical activity of the brain. Electrical activity of the brain. Let's talk about some sample procedures of the nervous system. Aneurysm clipping. During this procedure, the microsurgical clipping, a small metal clip is used to stop blood flow into the aneurysm. A craniotomy is performed to create an opening in the skull to reach the aneurysm in the brain. The clip is placed on the neck opening of the aneurysm to obstruct the flow of blood and remains inside of the brain. Carpal tunnel release. During a carpal tunnel release, a surgeon cuts through the ligament that is pressing down on the carpal tunnel. This makes more room for the median nerve and tendons passing through the tunnel and usually improves pain and function. Carotid endarterectomy. This is the procedure to remove plaque that is clogging the carotid artery. The surgeon makes an carotid endarterectomy. This is the procedure to remove plaque that is clogging the carotid artery. The surgeon makes an incision along the front of the neck, opens the carotid artery, and removes plaque that is clogging the artery. The surgeon then repairs the artery with sutures or a patch made from a vein or artificial material, graft. Herniated disc surgery, discectomy. This is the procedure when the portion of the disc that is causing the pressure on your nerve root is removed. In some cases, the entire disc is removed. Endocrine system. The function of the endocrine system is to secrete hormones directly into the blood to help maintain important body functions. Hypothalamus. It's a portion of the brain with many key functions, including linking the nervous system to the endocrine system. Pituitary gland is a pea-sized gland via which the hypothalamus links the nervous system to the endocrine system. Thyroid gland. It's a gland shaped like a butterfly located at the base of the neck that controls the rate at which the body uses energy. Parathyroid glands. These are 4 small glands in the neck behind the thyroid. They release parathyroid hormone and control the calcium in the blood and bones. Pancreatic islets. They are parts of the pancreas that produce insulin and glucagon. Adrenal glands are triangle-shaped glands above the kidneys that produce steroid hormones. Testes, in men, are both gonads and glands that produce sperm and testosterone. Ovaries, in women, release ova or eggs and release progesterone and estrogen. Hormones of the endocrine system act as messengers. They regulate activities throughout the body. They also trigger responses in specific organs or tissues. Let's look at some sample terminology related to the endocrine system. Adenectomy. It's a surgical removal of a gland. Adenopathy is a word used for swelling of the glands, which release chemicals like sweat, tears, and hormones. Adenectomy release chemicals like sweat, tears, and hormones. Adenopathy typically refers to swollen lymph nodes. Adrenal gland is a small gland that produces the steroid hormones, epinephrine and norepinephrine. Adrenaline is a hormone that triggers the body's fight-or-flight response. Now let's talk about some common disorders or diseases of the endocrine system. Number 1 is diabetes. Do you know how many types of diabetes are there? There are 3. Type 1 diabetes. That's a metabolic disorder of the pancreas when it produces little or no insulin, hormone responsible to help glucose get into the cells of the body. Type 2 diabetes means that your body does not use produced insulin properly. There is either not enough insulin or the body is resistant to it. Gestational diabetes is the diabetes diagnosed for the first time during pregnancy, gestation. Like other types of diabetes, gestational diabetes affects how your cells use sugar or glucose. Gestational diabetes causes high blood sugar that can affect the pregnancy and the baby's health. Please remember, anything with hypo means insufficient or low. Hyper pertains to excessive or high. Itis means inflammation. For instance, hyperthyroidism. That's a thyroid disease when the thyroid gland produces too much hormone. Hypothyroidism is a thyroid disease when the thyroid gland does not produce enough hormone. Hyperglycemia. That's the condition of higher than normal glucose level. Hypoglycemia is the condition of lower than normal blood glucose level. Pancreatitis is the inflammation of the pancreas. Pituitary tumors are abnormal growths in the pituitary gland. too much hormone. Growth in the pituitary gland. Hormones affect the function of many different processes in the body, including growth and development, reproduction, sexual characteristics. The pancreas regulates blood sugar and also helps with digestion. Immune system.